Let's begin part 2 of our multi-part series on the dental maladies caused by the stress of COVID-19. So let's roll that intro. What's up everyone, Dr. Eric Jackson here. Hope you're all doing well. Like I just mentioned, we're going to begin part 2 in the multi-part series of discussion about dental maladies that I've seen dramatically increase since we got back to work after the COVID-19 shutdown. In part 1, we chronicled this kind of an introduction to the topic, but as a brief intro, some of the increased frequencies of things I've seen. We've seen a lot of generalized gingivitis for nearly all our patients, right? So let's dive into that a little bit. So gingivitis, surface problems with your gum, entry-level gum disease, right? To some extent, we all have a low form of this, especially when you're due for a cleaning. But what I've been seeing is that patients that typically have been doing a great job, visit after visit, hygiene after hygiene, 6 months after 6 months, they didn't do very well. Now, why? Well, possibly they're overdue a little bit, because if your hygiene appointment fell in the 3 months of closure, well, unfortunately, we had to cancel it due to CDC guidelines and whatnot. We were only able to provide emergency dental treatment, and that dental hygiene visit does not qualify. So we had to bump it to after June 1st when we did the reopening. And then that's tricky because we ultimately had a lot of people stacked up because we already had June scheduled. I'm sure every dental office in the whole United States is like this. Certainly in my neighborhood it is. So we're trying very hard to get through all that. The glut, if you will. So added time, right? But also it comes down to why might this also be the case? Even if I've seen it for patients that had their teeth cleaned, early March, and then they're not due till right around now. They still have added plaque, bacteria. They have little swollen gums compared to what they usually do. They have a little more bleeding in their gums compared to what they used to. Gingivitis type symptoms. Well, ultimately, that's to be expected because of stress. COVID-19 has permeated our whole lives, turned it upside down to some extent. And yeah, things are kind of stabilizing to some extent, but there's still a lot of question marks out there. There's a lot of stress-induced maladies, not just in the dental field, that human beings are dealing with right now across the planet. So, generalized gingivitis for nearly all patients. If you had an A grade on your gums when you came in to brush to your 6-month checkup, I bet you have a B right now. If you had a B, I bet you have a C, and so on and so forth. The added stress has caused everyone to kind of a little more lackluster on their quality of brushing. Perhaps you skipped a few brushings. Perhaps you didn't really floss with the correct technique. Maybe you just kind of gave it a once-over instead of doing your normal routine because you're kind of prioritizing and preoccupied with other things. It's understandable. It's acceptable. I'll even say it's acceptable, but with that said, it's short term. We're allowing it. Everyone's allowed for some ups and downs, but you don't want to make it your new habit or your new normal, as to quote the whole phrase now. So gums have seen a dramatic increase, but also we've seen a dramatic increase in jaw and TMJ pain. If that goes along with multiple other topics I mentioned, tooth sensitivity, headaches, sore head and neck muscles, and tooth fracture. Well, the gums are a little bit different category, but these last 5 categories are all very classic symptoms of bruxism. Bruxism being the fancy dental term for grinding and clenching. Now, some people are grinders, some people are clenchers, some people are both, but ultimately it all falls into the umbrella term bruxism. So you get the phenomenon, and then it manifests itself in different ways. A lot of people ultimately sometimes they bristle when you ask, do you ever grind or clench your teeth? Oh, I don't think I ever do. I've never woken myself up. My spouse never tells me I grind my teeth at night, but yet they have a lot of symptoms. And we're not going to go into the symptoms of in depth here today. That's its whole other video series. But bruxism causes a lot of far-reaching, widespread issues, including all the ones we just mentioned. So, what are we going to do, and how do we protect ourselves against having these sorts of things happen? Protection, and then resolution of them if you have them already. What if you have you're experiencing headaches and sore neck and at an increased level compared to what you did before. Well, ultimately, let's go through a couple options. Number one, don't let your home care slip, right? Don't let your home care slip. Get healthy. Get your mouth back the way it was before COVID, right? Brush 2 times a day. Floss regularly. The mantra, floss, brush, rinse, in that order is my favorite because you always floss first. I remember they both start with F. Then you brush. Then you rinse with an excellent rinse to get all the little bits out and possibly apply some fluoride if you're using a great product, over-the-counter product like Listerine Total Care or Crest Pro Health. Those are fantastic. They do a very good job. Number 2, don't fall behind on your dental hygiene checkups, right? Your hygiene cleaning and your examination are very, very important because a lot's happened in the last 6 months, frankly, on this planet. Since mid-March, we've seen a lot of changes and a lot of stress. What's the best way to identify some of the potential problems? Well, go get a checkup and an exam. Now, you might have some reservations about that. Well, with that said, and I'm not going to debate all the different things. It's a very long topic, obviously, but dentistry is safe. The field of dentistry has taken excellent precautions to make sure that the risks are mitigated, right? Whether it's different offices and different techniques, each office is different. Each office has figured out the best thing for it. I know at our office we have a 10-point plan that we enacted prior. You can view that in our COVID-19 YouTube video series if you like. I was filming during the shutdown, both mid-March through the shutdown, and then when the reopening happened as well. It's safe. And on top of that, even if this is the, quote, new norm, your teeth need help. Talk to your dentist, talk to your office, ask them about what they've done. If you already don't know, which I hope you do, I hope the communication was high between your dental office and you, the patient, I hope that you already know all this. But if you don't know all of it, or if you've forgotten it, call them up and say, hey, essentially, how are you protecting me and how are you protecting your staff from the whole COVID-19 pandemic? Postponing dental treatment never pays off. Whether it was the dentist tells you have a cavity, and in the pre-COVID days, you don't let that cavity sit there, grow, get bigger, and become a root canal and a crown, when it could have been just a simple filling fix. Postponing dental appointments, postponing dental treatment never works because ultimately it always becomes a bigger problem, a costlier problem, and a more involved problem. And each of those, it just never gets better, right? Each of those is a negative. So, don't let your home care slip. Don't fall behind on your dental hygiene and checkup appointments. Next one, you don't have to have symptoms to be a grinder or clencher. I mentioned this a little bit earlier. Especially if you're a mild or moderate case, intensity matters. I use the same discussion with sleep apnea and snoring. The levels matter. Now, there's really no effective or quick and easy way to measure your bruxism. There's no gradient or whatnot like there would be a sleep test or sleep study for a sleep apnea patient. But with that said, it comes down to if you are waking yourself up, clenching, grinding, if you are watching this video right now and your teeth are touching or even clenching together, you might be in that severe category, that top third. If you are not doing that kind of thing, well, that doesn't mean you're home free. Mild and moderate cases exist without any real outward appearance to the layman. I'm a clencher. I have a tendency to clench my teeth. There's really not a whole lot of symptoms for mild and moderate patients when it comes to that. I don't wake up with sore jaws, but I know I do it because ultimately you can see certain wear and tear patterns in my mouth. Hence, a whole lot of different things we've done over the years. And we'll get into some of the solutions here in probably part 3. Remember the phrase cyclic fatigue, right? You probably learned it back in elementary school or high school or whatnot in your physics class. Cyclic fatigue is a term that is a mechanical engineering, typically, term. The classic analogy is when you take a paperclip and you try to break it. Well, you can't, right? You can't just rip a paperclip in half. I don't know anybody that can. But the way you break a paperclip is by repeatedly bending it in the same exact spot over and over and over again fatiguing that metal until the point of breakage and fracture, right? It is a cyclical pattern of fatigue, and that happens exactly the same way in your mouth. Your teeth are very strong. Yes, they can break. Yes, there can be an acute break like that, perhaps a sports trauma, or perhaps any real, frankly, it doesn't be on a sports field, it could be any acute trauma. But there's also the chronic trauma of repeated overuse, of high spots after a filling. Grinding and clenching is not considered the normal, right? It is overuse of your teeth. You don't need to be grinding and clenching them at night. They are meant to chew your food to obtain sustenance and nutrition. When you're grinding and clenching your teeth at night, you are using them above and beyond, and you are going to wear and tear them a lot. Tear them out quite quickly. Imagine a marathon or an ultra marathon runner. The people that compete in marathons and ultra marathons routinely, they are using their bodies to the absolute extremes that the human bodies can. Now, professional athletes the same way. If you're doing certain things over and over again, using them to the 110% of what they're supposed to be, parts wear out. Think of baseball catchers and their knees. Think of football players and their knees and hips and everything else, frankly. I mean, there are tons of examples of this. Your teeth are no different. If you are grinding and clenching, you are using them more than you need to, even if there's no symptoms. On the mild and moderate level, it might take longer for them to wear out, but you need to be prepared for something to break. And if something's going to break, it's going to be perhaps, later in your life, perhaps not as early as you might think, but it's going to happen either way. So those are the first 3 ways to protect your teeth against these types of maladies. In the next video, I'm going to give you 3 more and kind of bring this discussion to a close. Thanks so much for watching this video. As always, if you like the channel, please subscribe, hit the bell to get notifications when I release a video. Of course, please like the video if you like the content. Of course, put any questions or comments in the comment area below. Love seeing that. Always appreciate the good feedback from everyone online. Thanks again for watching. I'll see you in part 3. Take care. Have a great day. Bye-bye now.